Good evening, everybody. Hope you're enjoying the spring season and making most of the opportunity to get out and about. This sets the perfect stage for our discussion today. My name is Andrea, and today I will be guiding you through this presentation. Welcome to our Fall Prevention webinar. This is presented to you by AAPI, which stands for Aging Services Inclusive of Asian American Network. We are a technical assistance center and a resource development center for Asian identifying older adults, and we are supported by the University of Illinois, Chicago, the Administration of Community Living, and the US Department of Health and Human Services. As you know, we have live translations in Hindi, Urdu, and Cantonese, Mandarin, and Vietnamese available. You can pick the languages by selecting it on the globe icon on the Zoom panel, or you can select it based on your preference on our website. We're also thrilled to have a fantastic panel of experts joining us today. A gentle reminder to our panelists to speak at a lower pace, allowing our translators to effectively translate. And first up, we have Dr. Bhatt, professor from Department of Physical Therapy. Dr. Bhatt, could you please introduce yourself and share a bit more about your expertise?
Yeah, thank you, Andrea. Is that okay if I can share my screen?
Sure.
Hi, everyone. My name is Tanvi Bhatt. I'm a full professor in Department of Physical Therapy. I'm the director of the Cognitive Motor and Balance Rehabilitation Laboratory, and we're committed to actually teaching seniors how to prevent falls. So as we may know, 1 in 3 adults over the age of 65 experiences a fall annually. And this risk increases 6 to 8 times if we experience cognitive decline, that is, if you have problems with your memory, or you have any other pathology, such as a stroke. Now, there are many exercise-based programs designed to reduce falls. However, we have thousands of people still slipping and tripping. That's why at the Cognitive Motor and Balance Rehabilitation, we are committed to teach seniors how to reduce falls. First, in our lab, we start by examining why people fall. So we do a lot of science. We look at brain factors. We look at how people move. We look at how people generate muscle forces to try and figure out why seniors fall more. Next, based on what we've learned from our perspection or our examination, we target fall prevention. So if you come to our lab, we put you in a mountain climbing harness and have you experience about 40 simulated slips or trips, as you can see the people here. Now, you will not hurt yourself. This training actually teaches you how to respond implicitly to fall prevention. Here you can see someone playing a game while they're actually slipping. Now, this kind of single session works like a vaccine, and it helps prevent falls for a year. We might also teach you how to play a game. That is, while you're doing a memory game, you're moving. This helps you with kind of what we call dual tasking. And this, again, helps you prevent falls. Now, people who like dancing, dance is a great form of being active and preventing falls. So we might even have you kind of hook you up to a harness and move and groove, as you can see here. Now, of course, prevention is important, but we also like to give you something called as a prognostic fall risk score. So if you come to our lab, we're going to kind of record the way you walk. And just based on the way you walk, we can tell you whether you have a 50% chance of falling from a slip if you experience it, or 30% chance of falling from a trip if you experience it. We use novel technology such as artificial intelligence to do this very simplistically so that we can give you your kind of likelihood of falling so that you can get appropriate intervention if needed. So that's all from my side. Thank you.
Thank you, Dr. Tanvi, for such a wonderful introduction and an overbrief of all the amazing work that you do. And now let's hear it from Professor Lee, an associate professor from the Department of Occupational Therapists.
Hi, good evening, everyone. My name is Jenica Lee, and I'm an occupational therapist. So I currently teach in the Occupational Therapy Clinical Doctorate program at UIC, and I have many years of clinical experience working with adults and older adults in inpatient hospital rehabilitation settings, and as well as in their homes to help them engage in activities that are important to them in a more independent, confident, and safer way. The main goal of my work is to promote health and wellness and help older adults thrive in place. So this includes fall prevention, home modifications, and self-management of their chronic conditions. So that's my intro.
Thank you. Now that we've met our panelists, let's dive into our presentation for the next 30 minutes. Let's take a quick overlook at what we'll be covering over the next 30 minutes. In today's discussion, we'll understand what falls are and what puts you at fall risk, how you can prevent your falls, and questions that you can ask your doctor, and other steps that you can take to make your home safer. Apart from this, we will also share some important resources that you can seek to help you with the same. Did you know that more than 1 out of 4 Americans aged 65 and older face falls each year? Falls are indeed serious and costly. In 2020, the emergency departments across America recorded about 3 million visits from older adults falls. Over 800,000 patients per year are hospitalized after a fall. Think about this. Falls can lead to physical injuries, pain, and even long-term disabilities. 1 out of 5 falls can cause broken bones or head injury, and 95%, more than 95%, in fact, of hip fractures are from falls, usually by falling sideways. And also, let's not forget the physical toil, that is the fear and loss of independence that comes with this. Looking into more detail about what we know when it comes to fall risks among Asian Americans, we can see that research comparing falls among Asian American older adults and other racial groups actually show mixed findings. Some studies show that fall risk is lower among Asian Americans, while others show that it is higher or about the same as any other racial group as compared to Asian Americans. There might also be differences between the different Asian American subgroups. And the research also suggests that some Asian American older adults tend to avoid talking about falls, hide falls from their adult children as they don't want to worry them. They also have a fatalistic view about falls. For example, they believe that it may be destined to happen that way. They also may have limited knowledge about fall prevention. So, what is a fall? A fall could be defined as an unintentional event resulting in an individual coming to rest on the ground, floor, or at a lower level. It could be either a slip, which means losing balance due to slippery surfaces, like wet floors or an icy surface, Or it could be a trip. You could stumble over an obstacle or an uneven surface like a stone on the road, maybe. It could even be a stumble that is tripping over one's own feet or losing balance momentarily. But here is why this matters deeply. Falls, whether they result in injury or not, have a significant impact on our quality of life. It is something many of us can relate to, especially as we witness a growing number of older adults fearing fall, which often leads to them limiting their activities and social engagement. So, here's a quick question for both our panelists, Dr. Tanvi and Dr. Jenica. So, why do you think that it's not a good idea for older adults to limit their activities due to the fear of falling?
Thank you, Andrea. I can go first. So I think there are several limitations or consequences of limiting your activity as a due to fear of falling. One, it really limits older adults physical fitness, so avoiding activities can in turn increase your muscle weakness because you're not now using your muscles. We call it disuse, which further kind of reduces your balance and your overall physical functioning, and then in turn increases the risk of fall. So it's like what we call it, like a vicious circle of doing this. Also, restricting activities can then impact your function, your activities of daily living, which Dr. Jenica Lee can talk a little bit more about. But like doing transfers, sit to stand, toileting, bathing transfers, car transfers. So it makes older adults more difficult for them to actually perform their tasks more independently. And we're actually wanting them to continue functioning independently. And then again, restricting activities can then lead to social isolation because of fear of falls. You're going to limit moving and withdraw, right? Like if you're going to the grocery store or if you're going out to meet your friends, you're going to be afraid, oh, the weather is not good today, let me not go out, right? And then that will continue, escalate, and then leads to social isolation. It can make you more lonely, and then that has other consequences. And then overall, it reduces your quality of life. And believe it or not, it impacts one's happiness. So really, there are more benefits to being active and moving rather than reducing your activity just because you're afraid that you might fall.
Mm-hmm. No, I think Professor Bhatt covered both of the main important areas in terms of, that it is very important to stay engaged and stay physically active because, like Dr. Bhatt talked about, all this can have a negative domino effect. When you start to have muscle weakness, then that will impact how well your body moves, and that can translate to decreased balance with walking. It can also increase, if you have some long-standing issues already, that can actually worsen some things you might have, including increased swelling. You can have increased joint pain from disuse and not really moving. So again, definitely can really impact your daily activities. And also what Dr. Bhatt said about that you can also have a negative mental impact, which can decrease your confidence in doing things and can lead to depression as well. So for sure, a very significant impact in both physical and mental health.
Yeah, thank you for sharing that with us. So, moving on to debunking some myths about falls. Fall is definitely not a normal part of aging, which means that aging doesn't automatically mean that you'll fall. Many falls can actually be prevented with proper precautions. The risk of falling can change over time due to various factors. These factors being balance, medications, or vision. And we will talk more about these risk factors in our next slide in detail. And there are also many strategies to reduce the risk of future falls even after experiencing one. Many fall prevention strategies are actually pretty simple and they're low cost and very easy to implement. So, some risk factors are, um, are like age-related psychological changes, physiological changes, my bad, I'm sorry, behavior and choice, environmental risk, and social and economic factors. So, certain lifestyle factors and habit can increase the risk of fall, like no physical activity, poor nutrition, alcohol consumption, and misuse of medication. Hazards at home, like slippery or uneven surfaces, even poor lighting can cause falls. An environmental risk will also be like a lack of supportive structure in the bathrooms or stairwells. We will discuss this further in detail in our upcoming slide. And when it comes to social and economic factors, limited access to healthcare, including preventive services and rehabilitation, can also cause falls. Social isolation and financial constraints increase an older adult's vulnerability to experience a fall. So, what can you do to prevent falls? Have you asked yourself, are you concerned about or have you had a fall in the past year? You can also practice standing up slowly. If you have an assistive device, definitely ensure to use it, such as checking prescriptions for glasses, using special footwear if you're prescribed to them, or even having a bed alarm system are forms of assistive devices. This can reduce the risk of a fall. Using appropriate footwear that fits snugly provides support and stability to feet and ankle, thus reduces foot pain and falls. There's certain discussions that you should ensure to have with your doctor. So research shows that body composition can also affect fear of falling. Many individuals of European descent, as compared to Asians, as compared to individuals of European descent, have lesser muscle and more abdominal fat. This, in fact, puts Asians at a higher risk of insulin resistance, and for this reason, it is important to get an annual health checkup to monitor for diabetes. And having any side effects of medication can also cause symptoms of dizziness and also cause sleepiness, which can lead to falls. Ask your healthcare provider about the best type of exercise program for you. Exercise on its own, as well as with various combinations of fall prevention strategies, including vision tests and treatment, environmental checks, can influence changes that can be most beneficial. Getting your eyes and hearing checked regularly is really important too. Ask your doctor if you need any calcium supplementation and vitamin D supplementation because this can also reduce the risk of fall leading to injuries. So, quick bits of how to explain your fall to your doctor. So, write down the details of your fall if you experience it as soon as you can, and then discuss this with your healthcare provider. Or you can even call and tell your family members slash friends to note down the details as soon as you experience a fall. Your healthcare provider, and even contact your healthcare provider, though you may not feel like you are seriously hurt. These are the questions you should definitely ask yourself and explain to your doctor. How did you feel just before the fall? For example, were you having experiences of dizziness, weakness? Were you feeling tired, confused, or did you have blurred vision? Where did you fall? Where were you when you fell? Inside your home, or it could be outside in another environment that you regularly go to. What were you doing when you fell? Have there been any recent changes in your health? For example, did you start or stop a medication? Did you experience a hospital stay or a recent medical procedure? Or did you even have feelings of depression? Have you gone through a stressful event recently? For example, have you lost a loved one, moved, or retired? Here are some recommendations to keep yourself moving and staying active. Activity avoidance, like both our panelists mentioned, due to fear of falling, can have negative effects on your physical ability. Ensure to stay physically active and also stay socially active. Ensure your regular social activities are very regular and you engage in your hobbies as much as possible. You can do this by taking time and engaging in your local senior center or volunteer your time in different volunteering services. Exercise prescriptions should definitely be created by a qualified health professional who understand your background and health conditions well. And exercise also must be sufficiently frequent to have an effect on your health, which means that you should engage in exercising at least 2 to 3 hours per week. And physical therapists and occupational therapists definitely play a big role in helping you with the majority of health exercise recommendations. So here's a question for our panelists. Professor Tanvi, could you talk about some evidence-based fall prevention exercise programs that you would recommend to our audience?
Yeah, sure, Andrea. Thank you very much. You covered a lot and you kind of touched upon the frequency of exercising, which is very important, at least like 2 to 3 hours to get that required minimum physical activity. And then again, to consult some professionals who can design your exercise programs. And that's why there's a lot of research or evidence where the programs are well tested in large clinical trials. And some of them there's a program called the Otago exercise program, which is a home-based program, and it consists of simple muscle strengthening, balance, and walking exercises. And it has shown to reduce falls in older adults. There's also something called the matter of balance. And we have people from our own university who have been, kind of crucial in founding this program. That is, again, a group-based program. So you can get to interact with other people also while you do this program. And it's an 8-week program. You can do it once a week, or you can also kind of shorten it and do 2 times a week, where people actually teach you some tips. They give you fall education tips, simple exercises that you can continue doing at home. And then the goal is that once you learn this program, you engage throughout, kind of make it your lifestyle. It's kind of a lifestyle modification program where you exercise and pay attention to these tips that have been taught. Other similar programs are something like Fit and Strong, and that is also something which helps actually prevent or reduce your risk of arthritis, right? Andrea mentioned sometimes, or Dr. Lee mentioned, pain and reduced mobility can be, again, a fall risk factor. And the Fit and Strong program kind of addresses both fall risk as well as if people have osteoarthritis, it kind of takes care of that as well with the certain types of exercises that it includes. Again, there are a few others to list, such as Stepping On and Lifestyle Integrated Functional Exercise Life Program. And Andrea may have those as resources. But I also recommend just traditional programs such as Tai Chi, if anyone is Tai Chi practitioner or knows about this Tai Chi, which is an ancient kind of Chinese form of exercise. It is very, very good and it has good evidence to reduce falls. It is less impact on your joints, but it again strengthens your core. It strengthens your muscles. It involves like weight shifting, single leg balance. So it's very good for balance and fall risk reduction. And similarly, if people are familiar with the ancient Indian practice of yoga, there is upcoming evidence for yoga. And, it's something which people might be routinely doing. And that really helps, again, it not only helps physically, but Tai Chi and yoga also help with improving your kind of mental strength, increasing your attention, focus, and all of this also helps with fall risk reduction. So yeah, that's what I would recommend.
Yeah, thank you so much for that. And a question for Professor Lee. How can older adults incorporate more physical activity in their daily lives?
Sure. So I would say all physical activity, no matter how small, can have a positive impact on your health. So I think if you can start reframing that physical activity does not necessarily only mean traditional exercise like lifting dumbbells and doing sit-ups for 30 minutes, right? You can actually get a lot of physical activity through doing your day-to-day activities. So for example, to begin, you can pay attention to really look at your daily habits and routines, right? So just reflecting on how many hours per day or how many minutes am I sitting on the couch doing sedentary activities like watching TV? Am I watching TV all day? And just really pay more attention to how much you're sitting per day, and then figuring out how to reverse that, right? Can I do more standing? Can I incorporate a little bit more standing activities to make you less sedentary? So instead of sitting down to prepare vegetables or folding clothes, you can maybe do that standing up, right? So even that small incremental increase can really help amp your activity level. I think also another advice is finding a friend to do activities together in the community can also be very fun and motivating, and also keep you accountable too. So or even when you're going out grocery shopping, either by yourself or with a friend. If you're driving to the grocery store, you can think about parking a little bit further away so then you can get more steps in during that activity. And it's also good to just do a little bit more reflection on why you want to be more active, right? Ask yourself, do I want to be more active to get stronger, and or I want to improve my balance, or I just want to feel more energized, right? Because if you have lack of activity, that can definitely make you feel sluggish and less energy. So if those are your goals, then reflecting on that can help motivate you to increase your activity, especially if afterwards, when you do more activity, it really makes you feel good, and improve your energy as well as your mood, so you can latch onto that, and those can serve as important reminders. With all that said, I think it's a good idea to talk to your healthcare provider about your exercise and activity plans, because if you are going from 0 to 100, you just want to make sure that this increased activity plan isn't contraindicated. So it's always good to check with your healthcare providers. Tavi, you're muted.
I also have something just to add. This was very
Yeah.
nice, but again, just from my passion and like you mentioned, get a friend or, get someone else. But I do feel like, participating in any hobbies that you may have.
Right.
Like for example, I showed a dance video earlier. So like participating in Zumba, classes, which are safe. There are certain Zumba classes run by, YMCAs or other exercise activities, which are especially targeting seniors, so there is a silver sneaker program, I think, that used to be run by YMCA. So that can help any other dance form like ballroom dancing. If you have a partner, you would like to go out dancing. So I would like to add that in.
Hmm.
And sports, swimming is great. If you are a swimmer or would like to do some, engage in swimming as physical activity, also strength training, that's great. So any other things that would, make you feel happy, feel that you're engaged, plus give you the physical activity, then it's not like an extra thing that you have to do, So I always recommend that.
Hmm.
Mhm. So a lot to practice based on. So, like we just discussed, the more you move, the less likely you are to experience sudden falls. Fall prevention programs more are definitely more than just exercises. Chair yoga, when done seated or using a chair for support, is a great way to engage in exercises that can help prevent falls. And like Dr. Bhatt mentioned, traditional practices such as Tai Chi and yoga have shown incredible ability to improve balance, flexibility, and strength. And how to prepare yourself in case you may experience a fall in the future. Here are some precautions for the same. Having a cell phone or a telephone in all areas of your home and keeping them on lower shelves or table can help you reach them from the floor. Having an emergency contact number on or near all your phones and entering these numbers on a speed dial can help. Especially if you live alone, ensure to schedule a daily phone call or an in person check in with a friend or a family member. Consider even getting a personal emergency response system. Medicaid does cover personal emergency response systems in some cases, but it varies by state and program. So ensure to check in about this with your healthcare provider and talk to your healthcare provider about your options. It can either be a wearable pendant with call buttons to even having an advanced in home sensor network. So here's a short video on how to prepare to help your loved ones if they experience falls. Falls happen. We need to respond and not just react. A reaction would pretty much look like this: saying get up or pulling them, which is not a good plan. Let's look at options that are better. First, calm and reassure them and help them get their shoes on before getting them up. Option one would be to place a chair behind them and help them to position themselves to pivot around. Cue them to get up on their knees and to take support to pull themselves up, turn, and sit comfortably. Option two would be to ask them to bring their arms in as you squat down for a safe lift. Ask them to shift from behind to build momentum so that they can push themselves up with your help. Moving on, like we discussed, most falls actually happen indoors, so it is important to inspect your home. So here's a great guide available on the AARP website, and it's called Home Fit. It features smart and cost-efficient ways to make sure are safe and fit for older adults. English, Spanish, Chinese, Korean, and Vietnamese languages. There are even home fit videos to take a room by AARP Home Fit Guide. These videos are primarily in English, but the free Home Fit AR app, which is available for iPhones and iPad, can be used to identify the improvements that it fit. So more tips on preventing indoor falls. Ensure to involve your family members in the home inspection process. Regularly inspect your home to take proactive measures to mitigate if any safety risks or changes arise. Ensure that all areas of your home are well lit. Keep floors clear of obstacles such as shoe bags or electric cords. Even installing contrast color strips on the edge of each step can help with visibility, like the picture you see here of a staircase marked with bright contrast tape. Consider even using non-slip flooring material in areas prone to moisture, such as kitchens and bathrooms. And here are our recommendations for some evidence-based fall prevention programs. Many community-based service providers, such as your senior centers or the area agencies on aging, provide exercise programs for older adults. So ensure to find the one in your locality. You can do this by locating your state or local areas of agency on aging by going on the eldercare.acl.gov link that is given below. We have Fit and Strong, which is an in-person fall prevention program. Matter of Balance, which is provided either online and in person, which is available in English, Chinese, Korean, and Vietnamese. Tai Chi for Health Institute is in Chinese and Persian language, where the transcripts are provided in both these languages, but the voiceover for online courses are only in Chinese. There are lists of Tai Chi for Health programs, which includes arthritis and fall prevention, and even seated Tai Chi for people with arthritis. So this is the time for question answers to ask our panelists. Before that, please ensure to take this 2-minute survey to let us know about your webinar experience today. The survey is available in Hindi, Urdu, Simplified, and Traditional Chinese. You can simply click the link or scan the QR code. So without further ado, the platform is now open to ask questions to our experts. So panelists, moving forward, what do you think are the biggest priorities for preventing falls among Asian American older adults?
Andrea, thanks for asking that. I have, I'm living with my parents, and they are over 80 years of old, and my father-in-law, and I, have like one fall every 6 months to take care of. So, certain tips that I kind of would like them to do is what I would like to kind of speak towards. One thing, we already have covered that, participating in some form of, I would even emphasize strength training, be it a 30-minute class, any kind of, if you don't have weights at home, use like soup cans or bean cans, very cost effective, TheraBands are available, but some sort of exercise which could build your strength is important. fall prevention tips in your home. Regular home inspection, I think, is very important, which we kind of neglect, and proper lighting. And you've spoken to all of these things, but I think those are the key three things. One other thing which I would like to speak towards, or maybe is a little bit of a stigma, maybe in Asian Americans, is if you need to use an assistive device, if you see that your, balance is getting a little weak, if you're having more than 2 falls a year, it's okay to see a physical therapist, get some kind of official rehab, get, your plan for you to kind of exactly know, why am I falling? Is it balance problem? My sensation or perception is weak? Is it my vision? And then if you're prescribed a walking device, at least it'll keep you mobile, so proper shoes. Again, one other thing is, sometimes I see that improper footwear is also a problem. So those kind of external factors also need to be addressed. And that's what I would like to kind of say.
Mm-hmm. No, I mean, I agree with Dr. Bhatt. I mean, those are for sure, especially that I want to piggyback off of is that stigma, or just within the Asian American culture, especially the elderly, or just thinking about my parents as well, and my parents' friends who are all aging. And and when I work at the Asian American elderly agencies, they don't want to talk about it because there's some level of shame, I guess, or not shame, but well, partly shame, but I think it's also they don't want to be bothersome. They don't want to bother their children about it. So that's why they don't want to talk about it, because they're in denial, or they don't, or they think it's nothing, right? So I think part of, I guess, the priority from us as healthcare providers is to continue I guess, that education, right, that are culturally tailored to this population, so that whatever we provide them is going to be appropriate and useful for them. And I think the language barrier as well, to make sure that the education or information that we create or that we impart, that is accessible for the Asian American population. So wanted to add that piece to that.
Yeah, absolutely. Very well said, Dr. Lee. Yes.
Yes, thank you so
also,
much.
I would like to give, I mean, as children or, caregivers, I think we also tend to get overprotective, because culturally that's what you've done or you've seen probably, in the countries back home, that you will say, oh, if you have the first fall, you're going to actually protect your parents and say, like, try to do everything for them, and that limits their mobility, and that limits them from becoming more independent. As good children, you're going to get all the help that they need, but they do need to move, they do need to step out, in the
Right.
most safest way, go and walk out. And I often see myself telling my mom, oh, I think today you don't need to go out and walk, because I'm afraid if I'm in the city and something happens to her. But no, I think I should tell her, okay, here's your quad cane, here's your walker, be safe and go complete your 3-miler, and walk outside. So I think, yes, that's something for us to learn also.
Yeah, for sure. It's like that delicate balance between the filial and and that health promotion piece, that because you're making your mom walk and not doing everything for them, it's not because you're being a bad daughter, it's because you're trying
Yes,
to improve her
exactly.
health.
Exactly.